So this is just basically a general topic, but how this idea came, because in CIMS, I don't think so we have a clinic probably for adult vaccination. And regarding our practice, like basically we, even after COVID era, we are not finding people more willing to take vaccine like influenza and rubella. The basic idea I discussed with Bill Sarin said we just deliver a lecture and we can sit together all the specialty, nephro, cardio, intensive care, pulmo, and all the specialty, those who deal with vaccination, like transplant team also. And so we are in planning to develop a adult vaccination clinic at CIMS Hospital, but we'll just discuss how, which are the important things and what are the updates in vaccination, particularly related to the lungs and critical care. And this, I would like to request all the panelists, also those who have an interest in vaccine, at least be as this discussion as a panel discussion, just we can discuss in between also. So we'll just go within 10 minutes we discuss regarding mainly the updates regarding the influenza and pneumococcal vaccine. So as I told you, why the idea of adult vaccination? Because there are so many doctors who are asthmatic also, but they are not eagerly taking flu vaccine shot every yearly. So definitely, even our colleagues also, they are asthmatic, but they are not in. They are hesitant to take flu vaccination. Only once swine flu comes, they give the willingness to take vaccination, which are the right now recommended adult vaccination schedule. As I told you, the updates regarding pneumonia and flu vaccination, clinics, how we can just develop at CIMS Hospital, and open discussion regarding what are the suggestion of how we can go further. So, how as vaccines are effective? Just a simple question. Even because yes or no, how many say vaccines are effective? Vaccines are effective. Okay. Anyone say no? Those, even we have seen some doctors, they are not taken COVID vaccines also. Or someone would say it's a pharma driven. Every 10 yearly they change, like previously they recommend this one and now they recommend this one. And I won't take even if it is provided free also. Even we seen in COVID also, even the vaccine is free, people is not taking the vaccine. So this is the latest guideline from CDC recommendation. Those one you can see in the yellow, that is recommended for the adults who meet the age requirement, lack of documentation of vaccination, or the lack of any evidence of past. So yellow line, you can use it in all the, from the 19 years to 60, more than 65 years. So in most of the adult, you can use influenza vaccination. Now comes that there's a new vaccine coming, is a live attenuated vaccine, that is like a flu nasal spray. So as even in COVID also, we have seen that there are nasal sprays are available, but that is not related to like typically you can take the spray and you can get rid of the COVID. Or the COVID vaccine, they were tried also nasally, but the nasal route is not a successful route for any vaccination. And also we can see a TDP, Tdap, or tedious toxoid, MMR, varicella, that is not those who want to discuss, they can discuss. Those who want to have opinion also, they can opine. And those one in the typical, you can see of light is pink color. It is recommended vaccine for the adults with the additional risk factor or the another indication. And those you can see in the gray, there is no recommendation. So in that you cannot use this vaccine. So live vaccine, you cannot use more than 50 years. So any healthy individual, those who don't have access to the injectable flu vaccine, that patient, that healthy individual only can take the live vaccine. Now the second one is the pneumococcal. Now the update regarding pneumococcal is that we generally have a typically PPV 23 and PCV 13 available in 2000 from 10 to 20 or 22 till now. But the now new recommendation is coming with the PCV 15 and the PCV 20. They are coming with the one thing is that at least one single shot of any pneumococcal shot can give you lifetime protection. So that's what their message is from the CDC. And PCV, you can say pneumococcal vaccine, more than 65 years, you can give it to any individual. So that is a very safe recommendation from the pneumococcal side. Now we'll discuss each and every mainly flu vaccine and the pneumococcal vaccine, which are the updates. So whenever you, in this year, also we have this flu vaccines available. It is available in CIMS only. So the vaccine we available at CIMS Hospital is the Influvac and Vaxigrip. Influvac is easily available, and the new strain has come up with all the four things. So they they have 4 serotypes, 2 influenza A subtypes and 2 influenza B subtypes. all the vaccines covers H1N1. So those who have a fear to get H1N1, those who are having chronic condition, patients or doctor, they can definitely take this vaccination. And regarding influenza B's are not dangerous, but yes, they can some variant can cause a ARDS or the bad pneumonia. So there's a B Washington like virus and the Phuket. So this previously, before you can say 2021, we have only three viruses available in vaccine. Now they came up with the four. Why they came up with the four? Because when you give four this combination of the viruses, the response to the antigen that we injected is good, and the protection from the different viruses are more. Because when you inject some different more viruses, the body will get immunity against that virus. So that's how they recommend it. Now we have to, anyone who want to take the vaccination from today onwards, they have to take the tetravalent vaccine. That's a new recommendation. And we have only the egg-based vaccine in Ahmedabad available. We don't have typical nasal vaccine easily available, or we don't have a recombinant vaccination. So mainly we have is the Influvac and the Vaccine. So what is the recommendation? Anyone who is more than 6 months old can take the flu vaccination. But for as we are discussing with the adults, so every yearly you have to take the flu shots, like the COVID shots. Okay, what are the special precautions you can take for the flu vaccination? You have an egg allergy because this derived from the egg. They get the virus in the egg. How they make it. So those who have an egg allergy from the childhood, definitely they have to be watchful because vaccine can have an anaphylactic reaction in them if you give the vaccine. And those who have a history of GBS, it's a precaution, it's not a contraindication. So when you're trying to giving the influenza vaccine, just ask for the GBS history, whether they have a history of past history of Guillain-Barré syndrome. What are the vaccines I told you? Egg-based, live attenuated cell culture. We have this egg-based and live attenuated will come in future, but that is because of nasal strain. That's what we is very fond of. So we'll discuss that thing only. The dose of any injectable vaccine is 0.5 ml sub-Q IM. We generally give 0.5 EM. Mostly all the doctors have received for this year. What is now live vaccine? Live vaccine is the nasal spray. That is what we use in the any inhaler nasal rhinitis patient or those who have rhinitis, we use a nasal spray. It is just we have to give 0.1 ml in each nostril, 0.1 ml on the right and 0.1 ml on the left side, and that's how we can. This is the new variety of the vaccine for the flu. But still, as I told you, it has not been recommended more than 50 years. So it is 19 to 45 years. Those who are healthy only, they can take this vaccination. So as I told you, 0.1 ml each nostrils, and mostly seasoning will come. If the recipient sneeze immediately after there, those should not be repeated. So sneezing can happen because it's a live virus that we are inhaling it. What are the contraindications? Here the contraindications are more compared to the normal thing. Or contraindication, you can say precaution. So it's a severe allergic reaction, is a live virus. Age more than 50 years, any immunocompromised state, you cannot give this vaccine. You cannot inject the live virus into the patient's body. Pregnancy, cochlear implant. So these are the common, because this vaccine is not been studied in this population. That's why we cannot have a recommendation for this kind of population. And also, injectable flu vaccine, you can give it to any individual, even they are on oseltamivir for the prophylactic purpose also. But suppose the patient is on Tamiflu, so received influenza antiviral medication oseltamivir within previous 48 hours, you cannot give this vaccine. So this antiviral drug, they can kill the live virus and they can reduce the immunogenicity of the live virus that they are injecting. Now coming to the pneumococcal vaccination, this is completely new for everyone because we previously practicing was a PCV 13 and the PPV 23. Now they are coming with this new complete guideline by CDC. So that is anyone who is more than 65 years, not received any PCV or no any previous vaccination known, one dose of PCV, either 15 or 20. 20 when they were used is a single shot recommended for each and every individual more than 65 years old. If the PCV 15 they were used, it is followed by PPV 23. And those who have risk factor and less than 65 years of age, same schedule to be followed. So they are recommending now the PCV 20 will replace the PPV 23. The difference in the PCV is a conjugate vaccine and the PPV is a polysaccharide vaccine. Conjugate vaccine has a higher immunity position and has a better chances of reduction in the invasive pulmonary disease compared to the PPV 23. Dosing schedule mostly after 1 year, or those who have a chronic condition like a multiple chronic lung disease or liver condition, so they can take it 8 weeks apart. So after 2 months, you can give a subsequent dose. So previously you have given PCV 15, you can give it PPV 23. This is a new recommendation, but at present you want to follow it since it is PPV 23 followed by PCV 13. And we don't have any recommendation that suppose you want to give more booster immunity after 13 and 15, we don't have any recommendation. And this vaccine can be administered with each and every individual. You can give flu vaccine also in the same arm, and the second arm you can give the PPV 30. So as I told you on the second thing, you can see that which are the chronic condition in that thing you can give this vaccine less than 65 years old. Alcoholism, liver, heart disease, cigarette smoking, diabetes, implant, sickle cell, CRF, any immunodeficiency, HIV, Hodgkin's, immunosuppressant, and leukemia. So dose is same, like simple 1 year, stable patient, any chronic any underlying medical condition, after 8 weeks you can give the second dose. Okay, so why the PCV 15? They contains a 22 and 33 variant. We don't do a variant type of pneumococcal. But having said that, because of the trial, they have shown that these two serotype, if you cover it, they will give you the high immunity. So PCV is safe. The side effect is injection site pain, fatigue, and myalgia. PCV 20, this contains total 20, not 23. But having said that, they have 8, 10, 11, 12, 15, and adding to 22 and 23. Same thing, side effect. But this will replace the PPV 23 in future. So that's why we celebrate this kind of things. So the last few slides. So infection prevention is everybody's business. So how we can best prevent infection? Basically, I would rather say vaccine is the best thing to at least prevent to any infection. Not regarding gram-negative, but which are the things we can prevent? That is definitely ARDS and then pneumococcal pneumonia we can prevent. So definitely we'll go ahead with this vaccine clinic from the liver point, the gastro people's point of view, or any. So we need to involve all the specialties to develop the clinic at this hospital, and any discussion or suggestion from anyone, this house is open for discussion. Thank you.